friends, so today I'm going to tell you about how to take care after a distal radius fracture or a wrist fracture. So what do you mean by distal radius fracture? It's a fracture just around your wrist joint. There are two big bones which form your forearm, and the big bone, when it gets fractured, is called as a distal radius fracture. So if it is fractured, there are two ways which you can treat it. One is you can either cast it, put a cast on it, or a POP or a white plaster, or second, you will have to fix it with surgery, right? With some kind of K wires or some kind of plating. So if you don't do surgery, you need to get a complete cast put on your hand, and you have to take weekly x-rays and make sure that the fracture is not displacing or opening up. And what you have to do is go back and visit your orthopedic surgeon every week or hand surgeon and make sure that the fracture is in its place. And so when you have a fracture and when you have a cast on your hand, make sure that you keep your hand elevated. It should be above your heart level. That is, if this is your heart, it should be above your heart level. Most of the time it should be kept at this level, because otherwise the hand becomes swollen. So you have to keep moving your fingers as well, and make sure no water goes into the cast. Nowadays you have waterproof casts, you can take bath in them. But if it is not a waterproof cast, you have to make sure that water does not go into them. So usually a cast is kept for 4 to 6 weeks time. After 4 to 6 weeks, the cast is removed, and then you can start exercises. In the meantime, of course, your fingers will be free and you can keep moving your fingers. And once the cast is removed, you have to start moving your wrist and elbow and shoulder as well. Of course, the fracture takes about 6 weeks to 3 months to unite completely. So therefore, you cannot be lifting weights and driving two-wheelers and etc. immediately after we remove the cast. And you will get back to your original strength maybe in about 3 months' time from the date of surgery, from the date of application of cast. And you will regain strength and be able to go back to the gym in about 4 to 5 months' time. So we won't let you go back to the gym or lifting really heavy weights for up to 5 months' time. Now, if you undergo surgery, right, if you undergo either K wiring or plate application, so the first few weeks you may have a slab, not a cast. So slab is a one-sided cast, and the doctor puts in, or the surgeon, hand surgeon puts it in, because you should not, there's a lot of swelling that happens in the first few days, and a cast may not accommodate it completely. After a few weeks, you can be converted to a cast after the sutures have been removed, okay? And in the meantime, you have to keep moving your fingers. It's very important. Keep your hand elevated up to the level of the shoulder so that the swelling keeps coming down, right? And after a few weeks, you can be put in a cast or a splint, okay? And in 4 to 6 weeks time, everything comes off, and then we start your range of motion exercises on the wrist and elbow and shoulder. Okay, it's very important to start exercise very quickly, because it becomes very stiff. You have to move your fingers, exercise your fingers, exercise your wrist up and down, rotate your forearm towards and away from your face, bend and straighten your elbow, lift and drop your shoulders. So these exercises have to be done frequently in the immediate after surgery, and also after removing of the splint and the cast. Strengthening exercises start from about 6 week time, and the same timeline holds good. It takes about 6 weeks to 3 months for the fracture to unite, and you will be able to ride a bike and lift weights in 3 months time. But going back to the gym may take up to 5 months time, and usually patients do recover well with these kind of fractures. If you do want to get in touch with me, my details are given here. You please do get in touch with me, and take care, and thank you for hearing me out. Thank you very much.